Good morning, everyone, and welcome back from summer vacation. We are resuming committees this week for the County of Renfrew. Today is the Health Committee for Tuesday, August 16th, 9:30 a.m. I'm calling the meeting to order. As we gather this morning, I wish to acknowledge on behalf of committee and our community that we meet on traditional territory of the Algonquin Nation. We thank the Algonquin people and express our respect and support for their rich history. We're extremely grateful for their many and continuing displays of friendship. We thank also all the generations of people who have been careful stewards of this land for millennia. With that, I wish to inquire of the roll, but I want to welcome back to our chambers this morning, to our committee, Ms. Diane Johnson from the Bonnechere Manor, who is returning as clerk for this committee. Very welcome this morning, Ms. Johnson. Can you advise if the roll has been called?
Good morning. Thank you, Chair. Roll has been taken and we have quorum. Thank you.
All right. Thank you very much. I would invite now committee disclosure of pecuniary interest, and if there is any, the general nature thereof. I recognize none. I'd seek a motion to adopt the minutes of the previous meetings held June 14th and June 28th. Mr. Kelly, these are by virtue of a single resolution, correct?
That is correct, sir.
Thank you. Could I have a mover, please? Councillor Weir, seconded by Councillor Murphy. Any errors or omissions? Seeing none, all in favor? That is carried. We do not have delegations at the time of mailing. I'm assuming that continues to be so, Mr. Kelly.
Yes, sir, it does.
Thank you very much. I do also wish, just before we get into the meat of today's agenda, I want to welcome our incoming Deputy Clerk for the County of Renfrew, Ms. Gwen Dombrowski, who is joining us this morning. And sitting immediately to Gwen's right is our outgoing Deputy Clerk, Rose Gruntz. And I want to certainly celebrate Rose's long tenure, very valued tenure here, and I'm presuming you will have sufficient time to explain to Ms. Dombrowski where all of the secrets are hidden and kept locked away. I'm thinking that it is a vitally important function that is uniquely been filled by yourself, and I think that that's knowledge that is going to have to be transferred. So welcome to Gwen, and I want to appreciate your long-term service to the County of Renfrew as well, Rose. Thank you. With that, we will go directly into the administration report. Mr. Kelly, if you please.
Great, thank you, Chair, and through you, welcome committee, and good morning. So starting on page 2, you'll see my report, just a quick little report from the administration side, and that's actually where the warden has had to step out to, is a letter to the City of Ottawa addressing cross-border billing. As you recall, the chief and administratively, we've talked about cross-border billing and the challenges we've had with the City of Ottawa. You'll also recall the report were granted in June or May from Marv Rubenstein on cross-border billing and the challenges that many of our neighbors are facing with the City of Ottawa. We're not as affected as some of the other municipalities, but nonetheless, the joint meeting was requested. It has not been granted yet from the City of Ottawa. I know the warden is working with his colleagues in the city, but I'll note, not part of the report, but new information is that we are meeting with the Minister of Health at AMO on the Tuesday of AMO to discuss this, and I know that some, if not all, chiefs will be in attendance, as will the wardens and representatives from those neighboring municipalities. So just a bit of an update. Item number 2, again, is a piece on AMO, as you've been seeing in other committee reports, on the update of our delegation requests. And of course, we have been, as noted, we have been granted a delegation with PA Don Gallagher Murphy on the mitigation funding and the perhaps elimination of that in ensuing years that will cause tremendous levy increases to us, tremendous meaning by a 1.5% levy increase, with the elimination of mitigation funding. So we have been granted that. We are still working on the draft report that we'll be presenting to the PA, but that is there. And of course, the warden Your chair and myself will be in attendance of that meeting. And sir, that is the administration report for today's meeting.
Thank you very much, Mr. Kelly. Yes, it is. It does promise to be a busy AMO conference, I think. I think 3 for me. I'm not sure how many for you. It will keep you on your toes. With that, we will return to information item number 1, vis-a-vis the inequities in paramedic service building. Questions, comments? As much as anything, I think the change to the legislation itself within the Ambulance Act, which, if memory serves, correct me if I'm wrong, Chief Nolan, I think 2018, right up until 2018, there was an actual statutory requirement towards a reconciliation of the give and take as the seamless, the notion of seamlessness with the paramedic services, as the province is a 50% funder, nearly 50% funder. That as much the removal of that requirement from the statute, and on top of that, perhaps the intransigence on continuing to adhere to that, even on a voluntary basis. But I'm pleased that this is being pursued. Moving on then to item 2, the AMO conference. Questions, comments? I see none. Could I seek a motion, please, to accept the administration report? Councillor Wilmer, seconded by Councillor Grills. All in favor? That is carried. Thank you. And I will hand it over to Chief Nolan. And Chief, there is another new face in the room today, but I had assumed that perhaps you would be so kind as to provide introductions.
Yeah, thank you, Mr. Chair, and through you to members of the committee. This is Curtis Farrell. Curtis has been a paramedic for about 30 years, I would imagine. And Curtis is also in a leadership role at Algonquin College. Curtis has been a commander with the paramedic service for some time and has been an acting chief over the summer for me. And Curtis is also part of the deputy chief competition process. So until our paperwork is complete, we will not call him Deputy Chief Curtis Farrell. But at this point, Curtis has been instrumental in supporting my office through the summer months and is no stranger to the County of Renfrew, as he's worked here for some time as a casual commander and previously with the City of Ottawa as well, both in a leadership role and as in a frontline clinical role. So welcome to these chambers, Curtis.
Thank you.
All right. Thank you, Mr. Chair.
Thank you very much, and welcome, paramedic Farrell, with a designation to be named later. Thank you.
Yeah, we may come up with a symbol. So through you, Mr. Chair, to committee, I'll begin with the Emergency Services Report, item number 1, and we're really pleased to let you know that we have moved from the Grove site in Arnprior, which was the old Grove site. As you know, the Arnprior Hospital had redeveloped that facility and was very good to provide space for the clinics used by paramedics, originally around COVID swabbing, vaccination, and now sort of in full form as a COVID assessment center past, now a clinical assessment center for patients who require in-person assessment by paramedics. And we also do have some physician coverage at that site as well for certain conditions such as cancer screening and the like. So very pleased that we've moved over to 80 McGonigal Street. So Laura and her team were very gracious from the social services perspective to provide us some interim temporary space. And now we have established 2 clinic rooms within 80 McGonigal, as well as our community paramedic touchdown site in Arnprior. So very happy to provide that. I've had a number of questions since this even came into a report about how to access those services. And of course, we're encouraging people to call VTAC, work with the medical receptionist, who will either offer community-based services, physician consultation over the phone, and in some cases direct appointment times with the paramedics and or the physician at 80 McGonigal. So very happy to have that in-house, and that also times well with the transition from Arnprior Regional Health of the VTAC program to the County of Renfrew through our transfer payment agreement and all of the work that Mr. Kelly and the entire team have been doing to be able to transition that book of business over to the county and its partners with the Petawawa Family Centennial Health Team. Item number 2, Mr. Chair, is related to diversity and inclusion. There are 2 stories here that we thought we'd include for you. One is our own paramedic, Janil Kim, who has been with us for a number of years now. But Janil is incredibly proud of being a paramedic here in Canada. He emigrated from Korea and has done an exceptional job, not only as a paramedic but also as a leader within our community. And he stepped forward, as did Qasim in the next story, to reach out to their respective communities and share what it means to be a paramedic, their pride in being a paramedic, and in the county of Renfrew and working with our service. So we're happy to support them by providing a vehicle and giving them an opportunity to reach out to those communities. As you can see, the recruits are quite young in this picture that Janil is reaching out to, but we believe strongly in promoting diversity and inclusivity within our workspace, and what better way than giving them an opportunity to share it with their respective communities to be able to help these youngsters understand what it means to be a paramedic, but that it's also a noble profession and something that Janil certainly represents in terms of his leadership and his commitment to the county of Renfrew. And then secondly, we also provided a story of Qasim. Qasim's one of our paramedics, and he has engaged, as the story identifies, with the Muslim community, and he and his father both. His father is a senior police officer with Ottawa Police, and Qasim was very proud to be at his mosque and working with the youth of the mosque as well as the leadership in terms of recruitment, and also helping their community understand the role of the paramedic, how to use paramedics appropriately, but also that there is a future career path, and that we would welcome the opportunity to work with his local mosque in Ottawa, as well as Muslims throughout Renfrew County, to ensure that they are receiving culturally appropriate care, as well as understanding better the diversity and the range of services that paramedics provide. As well, there's a funny little jab in there with Mayor Sutcliffe that aligns with the CAO's report earlier when we meet with him, and we'll be sure to remind him not to be poaching our paramedics, and why he'd be so foolish to try, because of course they're very happy to be here in Renfrew County. So we're happy to share that, and I'm sure Craig will sharpen his barbs for that conversation as well. When we look at item number 3, Mr. Chair, in terms of the Association of Municipalities of Ontario, we were fortunate to get an audience on August 21st with Jill Dunlop, Minister of Colleges and Universities. And as I stated in my preamble, in terms of Curtis's work with Algonquin College, we have a very good line of sight in terms of both the challenges, in terms of future recruitment, but also the opportunities that exist in working with our universities and college partners to make sure that there are an adequate number of graduates coming out of programs that are funded by the ministry, and as well looking at opportunities, as we've discussed in these chambers in the past, about the advancement of paramedic education, including baccalaureate education opportunities for paramedics, because as Curtis would share, many of the students who are in the paramedic program at Algonquin College already have a degree. So by the time they graduate as a primary care paramedic, most of them have at least 6 years of advanced education, where there's an opportunity to align that, much like nursing has done with the Algonquin program. And then secondly, when we look at the Stay and Learn grant that came out from the province, all professions other than paramedics were given the opportunity to go to southern colleges. They only listed northern colleges for that grant. So we are going to call that an unintended oversight by the province, and remind them that there's certainly an opportunity to expand that list, because our community is eligible as one of the recipients for the Stay and Learn grant, yet the colleges within Eastern Ontario and Southern Ontario were not listed as they were for all other professions within that announcement. So we're gonna give a bit of a nudge on that one when we have a chat with the minister as well. And then item number 4, Mr. Chair, is the Treasurer's report, and I'm not sure the amount of detail you'd like me to provide, but certainly Overall, our budget is sitting reasonably well for this time of year. Certainly the COVID funding from January to March did assist, so thanks to the province for that. And as you know, we have a number of different projects upcoming with Eganville, for example, and so on. So we've also added in 2 additional paramedic units, as you remember, for the half-year funding for July going forward, and those are now on the road serving our community. So, and we've seen significant benefits already in terms of reduction of end-of-shift overtime and improved response and availability, especially in some of our more rural parts of the county. So we're very pleased at the result of that implementation. And this is all happening at a time when we have a significant offload delay because, as you may or may not have heard, COVID has not gone away, and there are significant staffing shortages in a number of hospitals that we serve that have resulted in significant offload delay over the past 2 weeks. So we're keeping a close eye on that. But the addition of those 2 units has helped us find some reprieve and be able to maintain some additional capacity in the community. So we're happy to report that. Mr. Chair, I'll turn it back to you.
Thank you very much, Chief. So committee, bear with me one moment. Back to page 6 for review. Any questions, comments on item 1 with the move by RCVTAC in Arnprior? Councillor Nicholson.
Yeah, thank you, Chair. And related to RCVTAC, not specifically the move, although I'm very happy that it's been so smooth. I'm just wondering, we learned through this past spring the importance of RCVTAC to the community, the greater community, the challenge we had with the province to secure funding for multiple years. I'm just curious if it's possible, if there are statistics that could be included in our report, so we had an idea of the impact that RCVTAC is having on the community on an ongoing basis. And just so that then the chief would be able to make comment toward any trends or changes that might be displayed in those statistics.
Something like along the lines of a KPI, key performance indicators, because I think that data, I don't know if it's still maintained on RCVTAC's site, but maybe it could be incorporated, Chief.
Yeah, thank you. And I think that that aligns well in terms of the conversations that the CAO and I have had, in that we're in the process right now of completing the transfer payment agreements, as you recall, with the province. And we've recently been able to negotiate a physician compensation model with our partners at Ontario Health, the Ministry of Health, and our operational partners at Petawawa Centennial Family Health Team. So I think that committee would benefit from a broader discussion and perhaps a presentation regarding the current status of VTAC overall, inclusive of those statistics. We've also, as you recall, approved standing up a committee to be able to engage the broader population. And that work will be beginning, I expect, within the next 60 to 90 days, when we'll be able to stand that committee up. So we'll have a better idea of where the province is at in terms of the final strokes on the transfer payment agreement. Craig, would you agree in terms of that process? And that overall, from a statistic perspective, we'd like to show you what VTAC is able to provide the community, because we are expanding the role of the paramedics in the program, starting into doing some routine assessments as well for patients who do not have family physicians, which I think is a key piece. It's not only going to be those that are calling in, it's also those that haven't had essentially a physical. While we'll not be providing a fulsome physical, we will be doing some work within the community amongst the population who have particular risk factors. And following on the National Health Service model in the UK, it's been an exceptionally productive program. So we would be happy to bring that back. I would suspect it'll be in September, October, when we have a very clear picture in terms of the province's position, the language related to the transfer payment agreement, and we'll have at least 6 months worth of statistics available for you from this operating year. Yeah. Craig, is there anything you want to add? Because I know you've been doing a lot of work in this space.
No, thank you, Chief. And through you, Chair, with some latitude on VTAC, since we're on the topic, I guess, if you don't mind. So the Chief is right. We're still waiting for the transfer payment agreement from the province. We anticipate September. It just takes a long time to work through this. The draft is there, but the ministers, I guess, are working through it in their offices and their chiefs of staff. but we'll continue to socialize this. I'm sure at AMA I want to thank all the ministers for their support and remind them that it's multi-year support, not ending the end of March, just to put that bug in their ear. I'll note that, 2 weeks ago, Mr. Farrell, I think maybe last week, the VTAC is actually rising to the notice of several folks, including an MP, Ottawa Centre, Mr. Yasser Nakvi actually requested through Sean Conway, many of you know Sean, to tour the Care For facility in Pembroke. So Curtis and crew, Curtis and crew sounds like a band, I guess, a little bit, showed Mr. Nakvi the operation. He was quite impressed with how VTAC runs. And so it's rising to that occasion. So much so, strangely, there's some noise out there in the ether about a regional virtual care clinic that Ontario Health is now rolling out. It's the East Region Virtual Care Clinic, and there was some noise on MyFM and a few other media outlets who have taken this, that the Eastern region now, from Kingston through to Pembroke, as per the website and per the media release, you can dial in and get a nurse practitioner and get all the care you need. And it kind of rose to the occasion of, wait a minute, that's what VTAC's doing. Now, the noise is that is what VTAC is doing. So wherever VTAC isn't, Ontario East Health Clinics will take that care, but VTAC will still be continuing to offer that in our region. So if you recall, gosh, a year or two ago, this was contemplated by the Minister of Health or Ministry of Health to roll out these Eastern clinics throughout, well, I guess it's provincial clinics, I guess, throughout in regions. And VTAC is still going to maintain that. So again, VTAC is being recognized. The model is being replicated in different fashions throughout, but again, rising to the occasion. So again, thank you for the latitude, Chair, but just wanted to bring you a bit up to speed on where VTAC is at the moment.
Thank you. And also, I am aware Mr. Kelly had advised of the Ontario Health East initiative. That has been in discussion for quite some time. There was some overlap. In fact, it may have even been in 2022 when that first was presented. I wonder, again, we're certainly digressing from where we started, but I have been dropping breadcrumbs, fairly certain I can get back. Chief, if you could just perhaps expand a little bit. I think that is a different model, but certainly akin to VTAC.
Sure. Thank you, Mr. Chair, and thank you, Craig, for the explanation. And maybe just to loop it a little bit back into the transition to 80 McGonigal and the importance of that role, because certainly the services that Ontario Health East is purporting is very akin to telehealth, right? Where you'd call, you'd speak with someone, and then they're very good at connecting with local services. They have different statistics than we do in terms of 911 avoidance and hospital avoidance. We're sitting at about 2% of the people that call VTAC are asked to go to the hospital. And so we're very proud of that. And I think it's also important to note that the Ontario Health East Initiative from the outset has acknowledged the important role of VTAC, and no different than telehealth or any of the other services that are out there. They are to refer patients to VTAC. So I'm going to essentially call it another 1-800 number that gets you back to VTAC, because the intended role of the Ontario Health Program is to provide services where services don't otherwise exist. We have VTAC, so we have representatives that have been sitting on that work and continuing to remind the province that VTAC provides both virtual care, which this program is intended to provide, albeit with a different level of provider, but we also provide hybrid and connected care within our communities. So by having the paramedics and the physician available at not only 80 McGonigal, to loop it back for you, Mr. Chair, but also to the other locations that we currently have within the county, our offering is more comprehensive, more connected to the community, and also provides in-person care and follow-up, which is not at all the intention of telehealth or the services that Ontario Health. So I appreciate that Ontario Health is trying something. You might even say that they've taken a bit of a page out of our book, but in no way is it intended to be a duplication, because those calls should be coming through to VTAC so that we can manage our patients in our way in our community. Thank you.
Thank you. Follow-up, Councillor Nicholson?
No, I just want to say thank you. That kind of detail is excellent and provides the context we need. And it just re-emphasizes in my mind the need for us to be able to keep our finger on this priority for Renfrew County. And the stats, to me, is just a tool for us to know that what we deem are the priorities for our community are being met by the investment that we're making in it. And then we can have an idea of those differences that we're delivering with this program compared to some of the other programs that are out there. So, yeah, Chair, I would just continue to encourage, if there is an opportunity for it to keep front and center, I support that. Thank you.
Thank you. Chief Nolan?
Yeah, thank you, Mr. Chair, and I feel the shepherd's hook in my side here, so I'll keep it brief. But as much for the people in the room as the people that may be listening today, rcvtac.ca has the running dashboard of the statistics. So point well taken in terms of the inclusion of them within the report, in terms of grounding the important work that everybody in the VTAC team is doing, and the degree to which the community has come to rely upon VTAC, especially for those people who do not have family physicians named in the community. So, but all of that dashboard is live and is available. And then there's also a tab on the website that has all of the published research. So Dr. Fitzsimon and the entire team have done an incredible job of continuing to interpret the statistics and the importance of the statistics as we continue to evergreen the program based upon the community's evolving needs.
Thank you. Councillor Murphy?
Thank you, Chair. A comment and a question. To Craig's point, Yasser Naqvi, of course, is running for the Liberal leadership for Ontario, and he was in Eganville last Tuesday, cited RCVTAC 3 times in his speech. And talking about, when we were milling about, talking about the innovation coming out of a rural Ontario environment, he was so impressed with it. Question, if A.D. McGonigal plays out, because I feel like this is sort of a pilot for you, can we replicate this in the new Eganville base?
Chief Nolan?
Thank you, Mr. Chair. It's certainly on the radar in terms of how we optimize the space. We have A.D. McGonigal. We're also operating out of Renfrew County Place. And as Craig said earlier, in the Care For site here in Pembroke. We have had what I call pop-ups throughout the pandemic, but one of the intended uses of the Eganville site is to create space. So as the community demand drives availability, because we have had a space in Cobden, for example, that we've been leasing from our partners there within the primary care group. We do have our eye on the Eganville site for that use as well. I can't make any commitments at this point, but I think given its geographic location, I think it could very well service an important part of our community.
Yeah, and I think so we want to be cognizant of the western part of the county of Renfrew and outside of that 60 corridor. Councillor Murphy?
Thank you, Chair. Yeah, just that all the sites you just listed are on Highway 17. And so I think, investing in this amazing new base, it gives an opportunity a little further out from 17. Thank you. Duly noted.
Thank you. Anything further on item 1? I think it's incumbent upon us also to express our deep gratitude to Ms. Lapine. Very graciously has been hosting the quite itinerant paramedics of no fixed address who now have a fixed address. I am sure that all parties are quite pleased to have now reached this amicable settlement. Chief Nolan.
A very brief shout out to Jason Davis and his team. Jason's made sort of miracles happen for us to be able to move in quickly. And there are other uses within that building as well. So it really was a game of Tetris to be able to move people in, move people out, move walls around, and create really a clinical space in an administrative building. So a huge thank you to him and for Craig's support in making all that happen.
Thank you very much for pointing that out. Excuse me. Moving on to item 2, diversity and inclusivity. Any questions, comments? Councillor Nicholson.
I'll make the comment. I think this is an excellent example of some of the things that we can use our employees to further diversity and inclusivity within the county. And I am very supportive of this initiative. And I noticed both of them are in Ottawa, tied to links with those individuals and communities in Ottawa. Are there similar examples that we can see that are these kinds of initiatives in Renfrew County?
Chief Nolan.
There absolutely are, Councillor, and I'd be happy to continue to provide those as well. It so happened that in the same month we had 2 individuals from staff come forward to us. I guess you could say to Mayor Sutcliffe, we're happy to recruit in Ottawa as much as he may want to recruit our staff in Ottawa as well, but that might be inappropriate. So, but we do work, and many of you have examples where you brought forward opportunities for us to engage in our diversity inclusion community here in the county as well. And frankly, it's something we're trying to get better at and make a real effort at. So, a big thank you to these 2 individuals, and thanks to all the paramedics that come out. I think it could be said even the presence in the St. Patrick's Day Parade is a good example of how we're trying to do some outreach and maintain our presence in the community. So thank you.
Thank you. Any further questions, comments? Mr. Kelly.
Thank you, Chair. Again, a slight latitude is that we are starting to see this across the corporation. So I think this is great that the chief included this in this report as we evolve as a corporation and as we start recruiting for different positions throughout the corporation. We're seeing people and faces that weren't traditional to this area. I tread carefully, of course. And it's refreshing. We're now conversing at lunch hours and evening events with folks of diverse backgrounds and learning things that we may or may not have learned from different parts of the world now. And of course, in long-term care, more than I think many others, Mr. Blackmore can attest that there's a lot of new faces in Bonachere Manor, of course, with the agencies and Miramichi Lodge with new PSWs coming into the community. So we're starting to see that blend, and hopefully one day this is just not news, this is just part of work.
Thank you, Mr. Kelly. Anything further? I think also this is absolutely consistent with Strategic Plan Goal 2, which is the workforce development. We spent a great deal of time in the development of the strategic plan on recognizing our needs going forward. It is certainly in the media right now. Unfortunately, it's in a negative sense of housing, and that immigration may be playing a role in housing shortage. But I think that the workforce that we are going to need in this country is absolutely demanding that our immigration levels stay high. I cannot say what sort of impact immigration has had on the housing market, but I know that without immigration, we would be seeing enormous shortages in human resources right across our economic sphere. And I think both for our workforce development, but particularly in the pictures that you're seeing here of paramedics Kim and Qasim, that it's important also that the immigrant communities can see them being reflected in the workforce, that this is now a place for them. It does so much towards encouraging that, and I know that it was tongue-in-cheek when the chief was mentioning the recruiting at the pre-high school level. That is not really part of our strategic plan, but I think it's important that the immigrant communities are seeing themselves reflected in the workplaces right across the spectrum, and I think that this is outstanding that we are seeing this in this, and I think absolutely we need to embrace this. So very pleased to see that. Yeah, Chief.
Through you, Chair. I think there is a dimension worth noting, and I think Craig brings up some very important positive elements to this. But I think it's also worthy of mention that a number of our staff who've come from different backgrounds have had an incredibly rough ride serving our community, given their diversity and their background. And we need to pull out all the stops in terms of supporting them with inclusivity. And it's one of Curtis's areas of expertise coming from the college sector, but also passion in terms of making sure that our staff feel valued by us and that we understand the challenges that they experience on a day-to-day basis working directly with the community. And they've brought me stories. I've had an incredible amount of empathy, but also shocked at some of the behaviors and language that have been used towards them. So, a big shout out to certainly Janelle, Qasim, and for rising above and really puffing out their chest to be proud of who they are, but also to recognize that that has come for both of them and a number of our other staff at a cost of forging a new relationship with our community where they've frankly been abused for how they look or how they talk or how they've shown up. So we need to be sensitive to that, and I would just encourage all of council and our communities for leaning in, recognizing the important role that they play to our corporation, to our department, but also to our communities, and just know that there's a strong sensitivity to that. And we'll be leaning into that with them to ensure they're reminded of the value that they provide and how much we value and appreciate the struggles that they've had to become paramedics, to continue to serve in that role, because obviously it is a high visibility in the community, and we deal with everyone, and they've been incredibly stoic and proud of the work that they do, and I just want to, echo that pride in terms of that we have in their role, and I'm really, pleased to bring this forward today.
Thank you so much for that, Chief. Absolutely, these are the faces, not just of the paramedic service, but of our community moving forward. And we absolutely, from my side of the room, we absolutely stand behind these folks and repudiate and reject those who would have perhaps a small notion of what our community is. This is our community, and we stand firmly behind them. So thank you very much for that. Moving on to item 3, AMO conference. Any questions, comments? And finally, the June Treasurers Report. Questions, comments? Councillor Nicholson.
Just a question on process, Chair, but I know we mentioned some of the improvements that we're seeing as a result of the investments that we made in the last budget process. As a part of the new budget process, do we get back briefed on those actual quantitative results? Is that the feedback loop? Is through the budget process?
Sorry, I'm not sure, unless perhaps Mr. Kelly or Chief Nolan, I'm not certain I'm understanding fully the question.
Yeah, and if I could, and so recognizing, Councillor, if I'm understanding your question correctly, that this is a mid-year improvement, but what we will be able to provide and what we historically provide is what our previous year's achievements were, as well as many of the pressures associated with that. So while, we may have paramedics more available in Cobden, for example, the net impact may be that Eganville gets to remain at base, right? So I'm not going to be able to draw a linear connection in terms of this improvement, had this direct impact. But when we look at the aggregate, I will be able to provide you what our actual service improvement was based upon, as Mr. Rubenstein, as Mr. Kelly referred to, showed the pressures, but we will be able to do a regression analysis to be able to identify what impact that has had, both at a cost level, but also at a service delivery level. So we'll be able to look at what our historics are in terms of end of shift overtime, for example, and we'll be able to pull out of that, and Curtis and Dave and Matthew have been looking very closely at this in terms of how many calls, for example, how many paramedic units did not end up on overtime as a result of being able to use a shift that's starting at midday going into midnight, for example. So we will be able to pull that out. And I hope that answers your question, and we will do that as a matter of practice, as we've done through the budget process as well, by showing you the performance indicators year over year, just remembering that we're going to have half-year benefit, so it won't be the full pop at this point. Craig, would you agree in terms of the process? Yeah. All right. Thank you.
Thank you, Chief. And from that, and from your affirmation, Councillor Nicholson, so I do understand the nature of the question. Certainly, none of the expanded service started, even in what's captured here, that was termed that is the end point is June 30th. What the Chief had been discussing was, at this point, anecdotal, I suppose. But I do anticipate that there will be a report coming forward. There were numerous charts that were the evidence that drove the conversation about the addition of the two 12-hour ambulance cars, on utilization rates, overtime rates, some of the perhaps less quantifiable, which is the burnout, the impact on morale of the paramedic staff. But certainly the early indications that the Chief made anecdotally are that we will anticipate that the bar that's going to stand beside the 2022 for the second half, which is the 2023 second half, is probably going to show some substantial change. Anything further on, though, the first 6 month, strictly the financial, the Treasurer's report. There were a couple of things that I just wanted to comment on. I am pleased, even though the top lines between the admin and the paramedic salaries, employee costs, and particularly it is the paramedic benefits line. It is a negative on those. It is under budget, and in particular the paramedic employee benefits, where we have seen substantial growth, driven largely by the presumptive PTSD legislation. It is refreshing. I note that, of course, it is only a 6-month report at this point, but it is certainly refreshing to seeing some change. Perhaps we might hope that we have hit the apex of our experience with that. In any event, that is refreshing. Also note the COVID funding had unbudgeted for the one-time COVID funding, about 2/3 down on the 9/11 side, just under $125,000. Very pleased at that. One thing also that I wish to draw to committee's attention, you will note just 2 lines above the one-time COVID revenue line, there is interest revenue, and oddly, the expectation is interest earned of $40,000 this year, with none recognized so far. But you will note in the both of the long-term care Treasurer's reports, and in fact the general that those who do not sit on F&A will see in the Council report. We are seeing at this point an expectation, should the Bank of Canada not begin to change its interest rates, we're going to be seeing interest revenues that are probably 4 times budget, at the minimum, 4 times budget. Keep in mind, I'd inquired of Mr. Foss, perhaps it was at budget time, on the Renfrew and Area Administrators Group. So currently, because of that significant arrangement with the Bank of Montreal, the deposits from the County of Renfrew and all affiliated organizations, and in fact I think probably even the City of Pembroke, they are not necessarily just municipal. Currently we are earning 5.7% on deposits. So it is one of the things I think that did provide me some comfort in keeping our levy down for 2023, is because typically the Bank of Canada interest rates is having a negative impact on the ratepayers in our community, but it is certainly alleviating our need to tax the ratepayer when we can be returning that kind of income on interest. So I would expect that probably on the revenue line, we've already exceeded the budgeted $40,000, because that has been our experience in both the long-term care and the general side. Anything further? Councillor Murphy.
Thank you, Chair. Craig, was there a thank you letter missing from the emergency services report? I will have it resent. I'll just touch, if you don't mind, Chair, since people are taking latitude all over the place.
Actually, I'm not. If it's not on the report,
Okay.
I am going to stick.
We'll wait and,
I have ventured far afield from the, and I'm not sure the warden has returned now. If he was still out of the room, I would take more liberties, but I'm kind of vying for this job again, you know, so. Well, perhaps in new business, as Mr. Kelly has suggested, if that would suffice. All right, thank you. Anything further than on the treasurer's report? Seeing nothing then, can I have a motion on the emergency services report, please? Councillor Weir, seconded by Councillor Murphy. All in favor? That is carried. Thank you. I think we will plow on. We're only 45 minutes in. So with that then, Mr. Blackmore, if you could take us through the long-term care report, please.
Thank you, Chair Donahue. Through you to committee. Good morning, everyone. Your report starts on page 11. And the first two items, they detail the bed vacancies for both county homes for the period May to July 2023. As you can see, both homes are continuing to maintain their 97% occupancy that's required to receive 100% of funding. Item number 3 gives an account of the wait list for the Renfrew County long-term care homes, which there are 9. Presently, there are 633 applicants awaiting placement from community and hospital, and an additional 240 that are already in a long-term care home seeking, that have indicated another number 1 preference. As you can see, both Bonnecher Manor and Miramichi Lodge have significant wait list numbers where resident applicants have indicated those homes being their first priority. Essentially, it works out to 1 of every 2 applicants, either in hospital or community or in another long-term care home, indicating a County of Renfrew home is their preference. Item number 4, it follows the May 31, 2023 County Council session approving request for delegation for the upcoming AMO conference, where I will be speaking with Parliamentary Assistant John Jordan, Warden Emo, Health Committee Chair Donahue, CEO Kelly, and myself will present a case for replacing case mix index as a funding model with our per diem based funding. The CMI, I mean, we get into it in more detail, but high level, essentially it's a model of funding that requires on data that's more than a year old. It's unaudited, it's labor intensive. It does generate a number of quality indicators, many of which are not typically used. And even those indicators, they're lacking by as much as 8 months. So with regard to utility, the question is, you know, is it worth the effort that goes into generating these reports? And a big factor that's lacking from the CMI indicators, quality indicators, is it doesn't really speak to person-centered care. It's very much based on a medical model of care. Item number 5 is the details the Ontario Health East announcement of a one-time 3% funding increase that was anticipated to be a 2% increase. The total is $14,617 for the Bonnecher Manor Senior Adult Day Program. Although it's titled as a one-time fund, there are expectations that it will indeed continue ongoing, but awaiting an announcement from the ministry to that effect. Item number 6 brings to the committee's attention a recent announcement from the Ontario government requiring that temporary agencies and recruiters be licensed effective January 1, 2024. So I think committee is well aware that throughout the province there's been a plethora of these agencies popping up, seeing the need to, well, it was an opportunity, I suppose, to help fill staffing vacancies. I will say, you know, it's probably not the best model in terms of the cost efficiencies, or not, well, lack thereof. The fact that these staffing agencies garner higher wages, and often facilities that use them are required to pay things like mileage and accommodation. So, and there have been a number of agencies that have been popped up that have been fraught with, difficulties, for lack of a better term. So, by way of requiring a license, it provides opportunity for a little more accountability from the province's perspective, and also the home that's engaging in agencies will have to ensure that these particular agencies are licensed, and failing to do so will be a violation of the Employment Standards Act. Item number 7 is the June 2023 variance report for both the Manor and the Lodge. As you will see, there are quite some significant variances in play, largely to do with COVID expenditures and recent announcements from the ministry with regard to getting each home up to those 4 hours of resident care. So money's floated to long-term care homes to get us there with regard to PSW, RN, and RPN staffing. So where the money sits, unfortunately, it's not 100% used because of the ongoing challenges with recruiting, in particular at Bonnechere Manor, to the point where we're engaging staffing agencies. We are approaching, getting closer to that 4 hours of resident care. We're hitting at about 3.69 at present at the Lodge, 3.04 at the Manor, but that does include staffing agencies at this point. Committee is aware of the efforts that have been put into place thus far to help get us where we need to be, and so far as recruiting at the Bonnechere Manor in particular is concerned, including our last council, the approval of the recruiting of international healthcare workers, for which I'm pleased to report we've already engaged in a number of interviews that are with some very promising candidates that we hope to have land within the next month or so. So that is, it's looking good so far as that initiative is concerned. I'm just trying to think if there's any. I think those are the numbers that stand out for the most part. But certainly, if there are any other questions through the chair, we can look at those. And just further to recruiting. So the Lodge was fortunate to add some staffing beyond the base. So we're at our next phase of introducing some additional hours as well. So recruiting campaign is underway.
I think just before we get into resolutions, we'll review the information items committee. So if you return to page 11 of today's report, I would invite any question, comment on the Bonnechere Manor resident statistics. Item 2, the same for the Lodge. Item 3, the wait list information. Item 4, the AMO conference delegation. Item 5, community support services funding increase. Very pleased to be happily surprised. That rarely happens. Item 6, government licenses for temporary agencies and recruiters. Warden Emo.
Thank you. Just clarification. The third last line says notice about the license, and then it says something remains valid unless notice has been issued by the director revoking the license. I don't think that is. Are you the director? Or is that the director meaning the provincial level?
The director at the provincial level.
Okay, thank you.
Chair.
Thank you. Anything further on item 6? I think that it's definitely appropriate that there is going to be oversight of the temporary agencies. It is certainly a burgeoning field, unfortunately, which is providing challenges. And in fact, if there's no more questions on item 6, then certainly on item 7, and I will start things off. It is mostly acutely, in my estimation anyway, demonstrated in the long-term care, the treasurer's report for the manor, and this is on page 15, particularly in nursing services. And I would draw committee's attention to the third line down, direct salaries, and you can see that we're 1.5 million, in fact 1.563 million underspent on salaries. Then I'd invite you to scroll down a little bit, and about 6 from the bottom you see purchase service and purchase service accommodation, where we're just under $1 million overspent. And you'll note particularly on the purchase services full year budget at $2,400. Seems to me probably past that sometime about the 2nd or 3rd of January, would be my guess. And I think that is, in dollars and cents, we are seeing the impact of the challenge of HHR, Health Human Resources, and it is being felt most acutely at Bonnechere Manor, more so than at the Lodge. And you can also see that reflected, just scrolling quickly, and this is again only the Manor, but on page 19, you can see that we had budgeted for we've been moving towards that finally adopted 4 hours of direct care, and since we are not quite meeting the threshold, then we're not yet eligible for some significant revenue funding. If I'm understanding correctly, you will see that half of the full year $2.1 million that was anticipated as revenue is 1.425, and we've received none of that. So I think that is demonstrating the challenge, as I'd indicated earlier when we were talking in the emergency services report, the incredible strain that our workforce is experiencing, that we've long sought the 4 hours of care, and we're not there on the 4 hours of care, and it is an inordinate challenge to Mr. Blackmore and all of his staff simply to meet our requirements to have the staffing levels. So this is, I think, underscoring the challenge of that. So just because we were discussing that, I wanted to put that on the table first. Any further questions or comments on the Treasurer's reports, either of them?
Just if I could, Chair, through you to committee,
sure,
just
Mr.
on the
Blackmore.
point of achieving 4 hours of care as eligibility, it's demonstrating an incremental increase in your hours from where you were before the funding was announced.
All right,
It's the
thank you.
threshold.
But that is the challenge that we're trying to surmount to make ourselves eligible for that.
Correct.
And it is, you will note, I don't know what page it is, but on that same line item, that revenue line item for the Lodge, there has been realized $30,000 of funding that has flowed through that envelope, but there has been none to the Manor. And just from the higher level, I think that's reinforcing the challenge that we are having with our staffing in the 2 long-term care homes. Once again, any further questions or comments? Final one that I have is I'm very pleased, at least similar to the emergency services reporting, that we are seeing some unanticipated revenues. They are at the bottom for the Manor. Certainly, they are on the bottom of page 19. We're at 90% of the PSW wage enhancement already, and IPAC, we're at 254% of the budgeted revenue that we've already received. There are several line items where we had not budgeted any revenue, one being provincial equalization, the other being PSW behavioral support. So it is at least pleasing that there are some supplementary funding envelopes that are being realized that we're unbudgeted for, or that we have substantially exceeded what we anticipated for the year. So that is certainly somewhat offsetting, particularly on the bottom lines of both long-term care homes. I think they have got a long way towards keeping those into like 5-digit deficit numbers, like under 100,000. I think it's 63 perhaps for one of the homes and 57 or something like that for the other home. In any event, very pleased at that. Any further question or comment? Okay, I see none. Then back to you, Mr. Blackmore, for resolutions, please.
Thank you, Chair. Through each committee, number 8 is a resolution in support of our latest incentive, as was previously alluded to get our recruiting where it needs to be at Bonnechere Manor. And it is, shall I read the recommendation first? a recommendation that the Health Committee recommend to the Finance and Administration Committee that that County Council approve the new corporate policy J06 Return of Service Incentive Program as a pilot project from September 1, 2023 until December 31, 2023 for Bonnechere Manor Long-Term Care Home.
And I would seek a mover, please. Councillor Wilmer, seconded by Councillor Lafreniere. Back to you for background, please, Mr. Blackmore.
Thank you, Chair. Through to committee, the background is that Health Human Resources continues to be a recruitment challenge for long-term care homes, particularly for Bonnechere Manor, in what appears to be a long-standing geographical challenge. Bonnechere Manor continues to utilize agency staff, and as approved by committee and council in May 2023, Bonnechere Manor has signed an agreement to employ up to 20 international personal support workers with an anticipated start in September. As we continue to align with the County of Renfrew Strategic Plan Goal Number 2, workforce development, implementing impactful strategies to achieve desired home-based staffing, staff is seeking committee's approval for the new corporate policy J06, Return of Service Incentive Program policy, designed as a recruitment initiative for Bonnechere Manor Long-Term Care Home as a pilot project from September 1, 2023 until December 31, 2023. And it's attached as Appendix Long-Term LTC 2. It is the intent to utilize funds remaining in the Safe Restart Agreement, SRA envelope, to cover the associated costs.
Thank you, Mr. Blackmore. Council, you've heard the resolution and the background. Questions, comments? Warden Emo, please.
Yes, through you, Chair. Are we going to be undertaking a little bit of an education process for the families and the residents of the Bonnechere Manor community to just explain the process and who's going to be undertaking care of them, just so there's no surprises or conflicts?
Mr. Blackmore?
Through you, Chair, to the Warden. We would certainly, the intent would be to advise that this is happening, but an education session, to be honest, it's not something we had considered, but it's not, we do have actually have a family education fair coming up on September 7th. So that may be an opportunity for us to engage that, have that discussion, as well as issue a communique to families. Thank you.
I think it's, if there's a running theme, if not to today's entire meeting, certainly to the long-term care, is the staffing challenges, the human resource challenge, certainly broadly across the health sector, I think largely right across the economy, but I know most acutely we are feeling it in long-term care. And once again, we have been innovative for quite a number of years in addressing this. Certainly our partnership with Algonquin College has yielded some substantial results. Likewise, we are demanded to continue to innovate and improvise to meet our staffing needs. And I think that perhaps we are not innovating here. I know that our Empire Regional Health, quite some time ago, within the last 6 months, has developed an incentive to recruit. This is certainly following along the same lines. We are in an environment that is outside, I think, of any of our experience, and it is demanding some innovative approaches. So I think that this is certainly following on the heels of that. And ultimately, the intent is to get people encouraged to join the field. And perhaps even, though there is that cooling off period, to perhaps even incent those who may have retired to give some reconsideration on perhaps returning to the workforce. Any further questions? Councillor Nicholson.
Yeah, thank you, Chair. And I completely agree with the approach and the initiative. I think that this is another step that we need to take in order to provide the level of service that we've committed to. So I completely support it. I was trying to understand all of the terms and conditions that were offered for some of these initiatives. Could we be faced with recruiting specialists from other long-term care facilities here in the community? Is that included, like paying people to leave their current jobs elsewhere in the county to come and work for us?
I don't know that that's the intent. I think that broadly across the sector, as I said, there is no part of the economy that's immune, I think, to the challenge. But again, within long-term care, it is certainly to be sensitive that robbing Peter to pay Paul is not beneficial to our broader community. But I would yield, Mr. Blackmore.
Through you, Chair, yeah, I would echo the same comment. It's certainly not the intention, but it's just the unique circumstances we find ourselves. You know, that's why this is specific as a trial for Bonnechere Manor. You know, given the fact that, you know, don't get me wrong, you know, agency staff are serving a purpose for us at the moment, but it's not our desired model of care. So if anything else, I think the fact that it's a trial, that it's for the one home, that's not without its own difficulties. But I think the circumstances warranted in this instance, and we'll have to see, I guess, at the December 31 what the result of that was.
Follow up, Councillor Nicholson.
Yeah, thank you, and I appreciate, Chair, Mr. Blackmore, just emphasizing it is a trial, and we are in a situation where this is one of the only other avenues available. And I think we can reassess to see what the impact is within the county if there is an impact after the trial. So given that constraints, I'm in support. Thank you.
Thank you. Anything further? Mr. Kelly.
Thanks. As I wade into this a little bit, and I don't want to presuppose the moving or the approval of this motion or the next one, or some of the other programs are being offered up as part of the FNA package tomorrow as well. So, and to you, Chair, to committee, we're obviously in a war or battle for staff across many sectors, including this one not so much as, or this one more so than many others. I think that this is part of a larger package that you've started to see roll out across the corporation of thinking slightly outside of the box that we've been in and expanding on this. I think where, if I can presuppose where the warden was going on this, and maybe where I would suggest Mr. Blackmore and his team go at Bonnechere Manor and other places, is communicating to the staff and residents of what's going on. That you know, these new packages, this one and the next one being proposed, these are efforts that we're undertaking to create maybe a better workplace for those that are overworked and feeling pressured to come to work more than their hours exist. So these are steps that we're taking, and I think communicating that out in your regular newsletters and social media, that's worthwhile to the public to say, here's the steps that the county is taking to make it a better place for all to live and work, particularly in Bonnechere Manor. Thank you, Chair.
And to add to that, too, I know that within both the Manor and the Lodge, there's a very good relationship between the administration and the Residents' Council and the Family Councils, and I think those are avenues as well to keep them in the loop on what's driving some of the change they're seeing, and unfortunately we are in that situation where we may have shorter-term employees, or have been having shorter term, particularly with the temporary staffing agencies that are not able to inculcate that long-term relationship with residents. That has been, you know, certainly I think a very, very significant advantage that our homes have been offering for some time. That is simply not the climate that we exist in today. But I think even in keeping with Councillor Nicholson's comments, I think that it is something perhaps to be cognizant of, that we match how we are addressing this moving forward with an awareness of the broader long-term care community locally, and that our community is not served by simply drawing them from other long-term care facilities and homes within the county of Renfrew. Yeah, thank you. Anything for Mr. Kelly?
Again, through you, Chair, just one last stab at part of this. Part of this international recruitment actually creates an opportunity, and Mr. Blackmore and I haven't spoken about it, but obviously we're dealing with generational issues with these homes, right? We've got different folks that have moved through a fairly homogeneous county. We're looking at bringing international students from wherever in the world to come in. I think that it creates an opportunity for education of our other staff as well as residents, whether they be through themed food days or this themed days to celebrate the diversity, like we talked about the paramedic report, to bring that full circle in the homes and could create an opportunity for those international students to showcase their countries, where they're from, their food, their backgrounds, their music, and otherwise to create an environment of welcoming. I'm sure unicorns and rainbows. Hopefully this would work, but we'll see where that goes. We've looked at the innovative approach of the butterfly or the chrysalis now approach, that this may play into another approach in how we approach new staff moving into our workplaces.
Thank you, Mr. Kelly. If there's nothing further, I would call the question. All in favor? That is carried. Thank you. And back to you, Mr. Blackmore, for item 9, please, bylaws.
Thank you, Chair. Through the committee, item 9 is a recommendation for a bylaw concerning contracting of employment agencies up Honorshire Manor. And the recommendation that Health Committee recommend County Council adopt a bylaw to authorize the Warden and the Chief Administrative Officer Clerk to engage in an agreement with Maple Tree Employment Solution Services for the provision of agency staff services at Honorshire Manor. A second recommendation that...
Actually, perhaps, I'm assuming because they are written out as two, do we wish to have two distinct resolutions? So I will seek a mover for the resolution Mr. Blackmore has first read. Councillor Yon, seconded by Councillor Grills. We will now move on to because the background is the same, we will go on to the second one, and I will seek the mover for that one as well, mover and seconder, and then we will vote on them respectively. Second recommendation, please, Mr. Blackmore.
Thank you, Chair. Through the committee, recommendation that Health Committee recommend County Council adopt a bylaw to authorize the Warden and Chief Administrative Officer Clerk to engage in an agreement with Valiant Hearts Healthcare Services Incorporated for the provision of agency staff services at Honorshire Manor.
And as indicated, can I seek a mover, please? Councillor Murphy, seconded by Councillor Weir. Background, please, Mr. Blackmore.
Thank you, Chair. To committee, as background, Honorshire Manor, with support of the committee and council, continues to engage in various strategies to support the recruitment and retention of staff. Initiatives currently underway include the corporate policy J04 employee referral bonus program, as well as the recently approved initiative to hire a maximum of 20 international person support workers. Until such time as these programs come to full fruition, we continue to rely upon contracting agency staff in order to provide frontline care services. We are seeking committee's approval to request County Council to adopt two bylaws authorizing the Warden and Chief Administrative Officer Clerk to engage in agreements with Maple Tree Employment Solution Services and Valiant Heart Healthcare Services Incorporated for the provision of agency staff services to support the required staffing complement at Honorshire Manor. With the ongoing staff challenges, Maple Tree Employment Services has been providing agency staff since July 2022, at which time the agreement was vetted through our legal counsel and agreed to by the Canadian Union of Public Employees Local 1508 through a letter of understanding. Due to staff challenges experienced over the summer period, July 2023, Valiant Hearts Healthcare Services Incorporated commenced the provision of agency staff services at Honorshire Manor on an agreement vetted by the legal counsel and accepted by QP Local 1508 via a letter of understanding dated July 2022. We are seeking committee's approval to request County Council to adopt bylaws authorizing these contractual agreements.
Thank you. With that, questions, comments? Warden Nemo.
Just a quick question. First, the observation, the Maple Tree contract certainly looks like I did it on my home computer, so I understand why the government wants to license these operations. And then secondly, because I see on page 3, cover vacation pay, cover WSIB, I think there's better language than that, but anyway. Out of curiosity, when I see the rates for the RN, RPN, PSW, how much of a premium is that over what we would normally pay? It's on page, I'm sorry, it's on page 32 of the report or page 3 of the agreement with Maple Tree.
There is some slight variance between the two agencies, in fact.
Yeah, so I'm just sort of curious about, just the difference. And you can send that out after the meeting if you don't mind.
I can take an initial, because this is raised before, with regard to the difference. And as I recall at the time, we equated it to roughly being the overtime equivalent.
Okay.
And as far as variance, one contract to another, and that's the nature of, we see that they're not all the same. When we look through contracts, we basically looking at the best rates and those who could actually pull it off. In this particular instance, the individuals that we engaged in this most recent contract with had had history of working at the manor. We were very familiar with their work.
Okay, thank you. And if we might develop our own standard contract with slightly better language, I think I'd feel a little more comfortable. Because cover is not really a word that I'm familiar with in any court cases I've been involved in. Thanks.
I think it's one step up legally, then look after. Anything further?
Or we're good for.
Potentially, we got it. Any further questions or comments on the item 9? Okay, then we are voting on these separately. So the first resolution was with respect to Maple Tree Employment Solution. I will call the question. All in favor? That is carried. Thank you. And now moving on to the second recommendation that was to engage in an agreement with Valiant Hearts Healthcare Services. Again, calling the question. All in favor? That is carried. Thank you. And finally, I would seek a motion to accept the long-term care report, please. Councillor Wilmer, seconded by Warden Emo. Further opportunity and final opportunity for questions on the report as a whole. All in favor? That is carried. Thank you. Returning to the agenda on page 1. So on page 47 are the Board of Health minutes for May 30th, 2023, and on page 55 are the Board of Health minutes for June 27th of 2023. And again, the resolution would be motion to receive the minutes of the Board of Health meetings of May 30th, 2023 and June 27th, 2023. Could I have a mover, please? Councillor Murphy, seconded by Councillor Weir. Any question or comment? We have 3 Board of Health members present in the room, Councillor Nicholson, Councillor Murphy, and Warden Emo. Warden Emo.
Just a general observation. One of the things that we've asked for most recently is, you'll note in the minutes where things are referred to the senior management team. So we've asked to make sure that things that go to the senior managers come back with some recommendations, because there seem to be a lot of things going there in the last little while. And I think due to workload, we haven't received as many answers back as we'd hoped for. So that's one of the things you should notice a little differently. And the other thing is, Chair Ann Akins has left, I guess, as of today, and will no longer serve on the board after, I believe, 6 years as a member, and the last 3 as chair. And so I will send a letter on behalf of County Council expressing our support for her service. It was, it was a difficult time for her to be leading the health unit because of the transition from one building to another in the middle of COVID, and then with COVID, and the evolving relationship that had to be developed between the health unit and municipalities, and particularly the County of Renfrew and the paramedic service and VTAC and all sorts of things. Like, there was a whole pile of things. March 20th, 2020 had to change by 4 o'clock in the afternoon. And, the health unit had to evolve as well. And I say evolve, and it's still evolving, but Anne was part of that. So I will express our appreciation to her.
Thank you very much. I think certainly personally, having served on the board for the entire term, or this term, I should say, from Chair Akins, because she had a previous iteration in her capacity as the mayor of Deep River, and I'm not entirely sure what her tenure was at the County of Renfrew in that role, but I know over the tenure of her time as a member of County Council, she was also a member of the board. So certainly commend Warden the letter expressing our deep gratitude for her service, and unfortunately I think that it is certainly been a challenging time to have been the chair of public health, and we certainly have experienced that also with the acting medical officer of health, Dr. Rob Cushman, who came on a short-term stay in 2017, and apparently his watch stopped and he only just recently retired again for the second time. So certainly enormous gratitude for Chair Eakins for her long service to the better health outcomes for our entire population. With respect to the first point I think that you made, there is an action tracking list that does show within these minutes, so it seems like there is already the vehicle through which those can be kept in the loop. Any further questions or comments on any item that may be contained in the minutes? Seeing none, all in favor? That is carried. Thank you. Is there any new business? Warden Emo?
I apologize. It's not so much new business. It's just a little bit of an update on the cross-border. That's the phone call I was on. So we had a very good meeting this morning. We do have a delegation with Minister Jones, and we have the document ready to go. And so our desired outcomes are to reestablish of the requirement that municipalities compensate others for calls responded to within their boundaries, as previously outlined in an Ontario regulation. And then the inclusion of the Pembroke CAC in the immediate rollout of MPDS in coordination with Renfrew and Ottawa. So on the first point, it's the cross-border billing issue, and then also how do we free up our staff from the respective counties so they don't get trapped in the Ottawa loop. And then with resist, we do hear unofficially that the MPDS rollout in Kingston is going to be coordinated with Renfrew and Ottawa, but we need that in writing. So we'll be talking to the minister about that. I have had my role in this has been to work the back room. So I've been speaking with Mayor Sutcliffe in Ottawa. He's more than happy to sit and talk to us about a coordinated approach on offload delays. Ottawa suffers from having 43 staff a day stranded in Ottawa hospitals, and they've got some strategies, and they want to work with us around that as well. We've shared our paramedic update with him. And so I've spoken to him twice now, and he's willing to meet with us and will meet with us, and we think we've got a path forward on a couple of issues. And I've spoken to Brian Patterson in Kingston a couple of times. I'm speaking with him again this afternoon just to make sure we're all on side going into AMO. So we are making some progress, better progress than we've made before, because Ottawa's open to having a conversation with us at the mayor's office, and that hasn't always been the case. So I wouldn't say I'm hopeful we're going to get to resolution. I'm hopeful we'll get to some common purpose on, if there are 10 issues, maybe we'll get the common purpose on 7. So that's kind of our goal at this point. Secondarily, we will be speaking to the minister about the minister putting a deadline on Ottawa coming to agreement with us. I told Mark that. I said, look, I only know how to do negotiations by having a deadline. So we're going to suggest to the minister that we'd like to have, we will voluntarily engage with Ottawa about the cross-border issue and freeing up our ambulances, but if there's nothing happens by the end of the year, we expect that the minister's going to act. So that's our approach, and Ottawa's aware of that.
Thank you very much for the update. It was certainly appropriate given our discussion of earlier. Just 2 questions. So I think you referred to it as NP. So that is, Kingston was not part of the initial cohort of the upscaled algorithm, if you will, that was anticipated to be used in the CAC, and that's what you were referring to, Warden?
Yes, the new program that allows, I'll give you my 3-second dispersal, and you can turn to the expert, but my impression was yes, it would free up resources that, as I believe it was the Code 4, would allow us some flexibility and free up resources for us and our partners, and it seemed to make sense to extend it all the way across the Eastern Ontario Wardens Caucus region, including Kingston, because it could have a negative impact on Leeds, Grenville, and I think Lanark feeds Kingston sometimes as well. And they're also tied to the Ottawa one, but Chief Nolan knows much more than I.
Perhaps even just the name. I think that the nature of is that there is going to be a much more sophisticated algorithm at the CAC to identify the particular needs so as to not be utilizing that emergent sirens and flashing lights to calls that do not actually require that. And it was simply the name of it. I couldn't recall, Chief Nolan.
Medical Priority Dispatch System.
Okay, thank you. The other question that I had for you, Warden, so the paramedic study that you're referring to, that was the updated Apex Pro, known also as the Rubenstein report?
Yes.
Okay, thank you. And thank you very much for the update. Any further new business? Councillor Nicholson.
Thanks, Chair. I was trying to be so respectful the second time through that I didn't divert our agenda on the long-term care. So I have a question, and I'm expecting that you'll tell me what to do with the question. So on the long-term care presentation, and I'll just refer to item 3 when we talked about the waiting list information. My curiosity gets the best of me. I was wondering if it might be possible to ask staff for a report at a future meeting, if that's appropriate. How many beds are we currently trying to have forecasted coming into the county that would address the 633, and the steps that we're taking right now to deal with the 33 that are on the wait list in Renfrew County? And I know that's not Mr. Blackmore's responsibility. From a county perspective, I'm looking at long-term care as a whole.
But just prior to handing it over to Mr. Blackmore, I'm sure that's doable. It is outside of the purview of our long-term care homes, but I think, and I could be mistaken, I'm not sure if it's 8 or 9 long-term care homes within the county of Renfrew, a mix of municipal, not-for-profit, and for-profit. And there is, and I'm probably going to get this wrong, but I know there was an expansion at the Grove in Arnprior, at Valley Manor in Barry's Bay, at, I'm not sure if it's Four Seasons or North Renfrew Long-Term Care in Deep River. Marion Hill also has an expansion. Among them, it's a not inconsiderable number of beds, but I think that we can put that together for the September report. What I will advise as a caution is it's probably only going to make a dent in the wait list for a short time, because we are aware of the demographics of that baby boom generation is now entering into their seniors, and we are anticipating a substantial increase in the seniors community. And though we have been seeing for some time on first taking up residence in long-term care, we are seeing them much older now than we formerly did. However, they are more acute. So I think that whatever dent we may be making into that wait list is probably going to be a short-lived relief. I think at some point those lifeboats are also not going to be sufficient, but I think that we can certainly accommodate your request for the September meeting. Any further new business? Seeing none, there is a requirement for a closed meeting this morning pursuant to Section 239 of the Municipal Act 2001 as amended, for the purpose of litigation or potential litigation, including matters before administrative tribunals affecting the municipality or local board. Could I have a mover, please? Moved by Councillor Wilmer, seconded by Councillor Yon. All in favor? Sorry, just before I do vote then, I'm going to leave the resolution, but I don't want to take a pause in closed session, so we are not going to be in closed session right now. The first thing upon reconvening in 10 minutes for a brief break will be to call the question. So we are now taking a break in open session. I want that clearly understood. With that, we are recessed until 11:05.
Fine.
There we go. I didn't say anything there officially. I have been muted, yes. In any event, thank you all for your patience. We are now returned to the point where we are going to call the question on moving into a closed session. It has been moved and seconded. All in favor? That is carried. We are now in closed session. Thank you, everyone. We have returned to an open session of the Health Committee. We are right at the conclusion at item 13, which is the date of the next meeting, which shall be Wednesday, September 13th, 2023. I would now seek a motion to adjourn, please. Councillor Wilmer, seconded by Councillor Grills. All in favor? That is carried. We are adjourned.